Our presentation today is our webinar is on design work for people, ergonomics and human factors. And I'm delighted to say that we have two really good speakers here today. First and foremost, I'd like to introduce my colleague, Colleen Butler. Colleen is a human factors specialist and also an inspector who has been with the authority now for a couple of years. She has done a lot of research in the area of human factors and human performance and fatigue management, and has worked previously with the Health and Safety Executive in the UK. So Colleen will be presenting first, and once Colleen has finished her presentation, we will then have a presentation from Matthew Birtles from the Health and Safety Executive of the UK. We're delighted to have Matthew on board here today. We've done a lot of collaboration with Matthew over the years. He has been involved in a lot of work with the authority in training our own inspectors in the area of ergonomics over many years, which has been very much valued by our inspectors. So Matthew is the principal ergonomist with the Health and Safety Executive and has done a lot of training in the area of musculoskeletal disorder risk management over many years, and he's involved in the consultancy service for the HSE as well. So without any further ado, I'll hand over to you, Colleen, to maybe begin your presentation, and hope you all enjoy today's webinar. Thank you.
Okay, so I'll just pop along to my first slide. So today I'm going to be talking about designing work for people being people, and this is very much how we view human factors and ergonomics, the disciplines that we're both talking from today. We know a lot about human behavior, human strengths and weaknesses from studies in psychology and biology, and we want to take those into account in terms of how we design work. And that's kind of a fundamental principle in human factors and ergonomics work. We like to think at the systems level and designing so that we are designing for people, putting people at the center, like the little graphic there on the slide shows people at the center of plant, process, product and place. And we're talking from two perspectives today. I'll be talking about strengths and limitations, but from the kind of cognitive or a mental, the mental fit between the person and their work. And my speaker after me, Matt, he'll be talking more about the physical ergonomics and the physical fit and how we optimize that and interventions that we use to help with that. So that's the perspective we're both coming from today. But as I said, I want to focus on the topic of work-related fatigue. And I'd like to really raise awareness of this topic, look at sources of fatigue, look at some of the health impacts and the safety impacts, and then I'll talk about some good practice in fatigue risk management. So it's a challenging area because we all know that fatigue it can be work related and non-work related. It has the sources are both work related and non-work related. So there's no magic solution here, but there are things that we can do. It's a topic that we are still learning on. There's lots of research and ongoing development in this area from all sorts of perspectives, from the medical world, from sleep science, from the impact of light on how we perform. There's a lot of things that come into play here, but I suppose I want you to think to go away from this presentation thinking that and believing that there are things you can do to manage this thing. So my next slide here is really wanting to highlight the reason why we're talking about fatigue right now. And one of those is the fact that, we know that it impacts on workers' health. And we know that it plays a role in workplace accidents. It increases the risk of incidents. And we can see that fatigue has played a role in incidents like loss of control over all types of machinery, including vehicles. When we're working in other hazardous tasks, so whether we're working at height or working with electricity, fatigue then can play a role there to an increasing likelihood of things going wrong in those contexts. And it also means that sometimes we make errors in following procedures because we are losing focus, losing concentration. So I really want to bring focus to the topic of mental fatigue today. I won't be that will be the focus of what I'm talking about, not physical or emotional fatigue, but mental fatigue. And one of the reasons we're talking about it also is because we know there's an increase in shift work. So the Central Statistics Office in Ireland, they've noted that there's a 15% increase in shift work from 15% in 2012 to 23% in 2023. So it is increasing. But fatigue is not just associated with shift work and night work. There are all sorts of working patterns now. We know the world of work is changing. So there are long hours, there are irregular hours, on-call working, and all sorts of work types with the gig economy and how things are changing. So in my mind, this is a really important and relevant topic. So hence why we're talking about it here. We also know that fatigue can impact on human reliability. Now, human reliability is a concept we talk a lot about in human factors, so to the point where there are lots of models and methods to quantify human error and quantify human reliability that are used in certain sectors. But fatigue is one of those things that is incorporated in lots of those methods and tools. So just to give some insight into how fatigue might affect us, we know from some of the research that fatigue-related impairment, it has been compared to how we impairment from alcohol. So, for example, sleep loss has been compared with when we're after 19 hours. An individual's performance can be equivalent to their performance when they have a blood alcohol concentration of 0.05%. And that's the driving limit in some countries, for example, Australia. So just to, it's a concept that can help people understand how fatigue can impact. We also know from lots of research on different patterns of shift work and night work that there's a risk of the risk of error increases with it's higher on night shifts. It rises with increasing shift length, and it is increasing over error increases over successive shifts, and particularly that are shifts that are night shifts, and when there's not enough breaks. And there's lots of research in this area that come up with similar trends in terms of findings around human error. Another thing we do know from some of that research is that there tends to be a lack of adaptation to night work. So generally people don't adapt very well to night work. There is some small portion of the workforce that are more able to adapt, but generally we don't adapt very well to night work. And also that anecdotally, certainly the first night shift can be particularly fatiguing. So I've also got on your screens there, just to the right, is a little graph that looks at alertness and time of day. And I just wanted to use that to point out that we know that there's this dip in alertness between 2 a.m. and 6 a.m., known as the window of circadian low, where we are more likely to make errors. So I just wanted to point that out with that diagram. Our alertness levels are changing throughout that 24 hours. So fatigue is not just about being tired. We know that it does have a significant reduction in mental and physical performance. And it's caused by being awake for a long time. It's caused by sleep loss and excessive mental and physical workload. And essentially, it is a biological need for sleep. So what are some of the signs and symptoms? We know that so when somebody is fatigued, they're more likely to make poor judgments. They're more likely to have memory lapses and lose focus, have slower reaction times, have more of an increased risk-taking approach, and irritable and mood changes. So those are fatigue signs and symptoms. The challenging part is that some of this can be quite invisible, so we can't directly measure fatigue. So that makes it harder to manage. And it can be something that builds over time. So cumulative fatigue is how we would refer to fatigue that builds over days and weeks and is kind of lurking in the background, and then it can be, you know, a contributory factor in an accident. So it has those facets to it that make it challenging. And how does it present itself in different jobs? It can, so a couple of examples here. Look, seeing the lorry driver, it means that it can be, you know, crossing the central line, falling asleep at the wheel, of course, worst case scenario. And other safety critical roles here. The ambulance driver, compromised judgment and decision making, harder to multitask. And as I mentioned earlier, yeah, this other facet where you're already doing something, working at height or working with electricity, and fatigue really impacts on those hazards and means that we may be more likely to take risks. So there are the impacts of fatigue on safety. I want to talk a little bit now about some of the health impacts from night work and shift work. There's been some body of research in this area which has looked at, in particular, night work and shift work. So we know that disruption of the body clock leads to sleeping difficulties and fatigue. So we are creatures that are supposed to sleep at night and be awake in the day, and so when you're doing night work, it means that you are trying to catch up on sleep in the daytime. That is not necessarily conducive to good quality sleep because of light, noise, temperature influences. So that can bring about sleeping difficulties. There are also there's lots of research being done looking at long-term shift work, particularly night work, and some of this has shown association between that and an increased risk for some health conditions like cardiovascular disease, some cancers, and similarly shift work. It's shown that it can exacerbate existing health conditions like diabetes and asthma. But this evidence is unclear, and one of the reasons that means it or makes it unclear is because of other factors, so lifestyle factors, in particular shift workers and night workers. It's maybe harder for them to adopt to healthy lifestyles because of things like it being harder to access gyms, access GP appointments at other times of the day than many daytime workers. So there are then resulting the potential for resulting impacts from poor diet and exercise and lack of exercise. And I've included on the slide there just a little graphic from the Sleep Foundation just to highlight the role that what we know a lot more about sleep health, and I'm not a sleep scientist, but there is a lot more understanding of the importance of sleep for health and how insufficient sleep increases risks for a number of conditions. Okay, so the next slide, I'm not going to spend lots of time on this because many of you will be aware of the legal duties and the 2005 Act, but fatigue it falls under Section 8, providing systems of work that are planned, organised, performed, maintained, and of course Section 19 around risk assessment. Other relevant sections are in the general applications. So for example, there is a requirement to take for an employee, before an employee starts night work, that they are assessed. So the employer must offer the employee an assessment by a registered medical practitioner. And there are other legalities in the application guidance that I've linked to on the screen there that will take you to some of the other responsibilities there for an employer on night work and shift work in the general application regulations. So what do we do when it comes to assessing fatigue risk? So it is important to take, I suppose, a kind of a wide view and take account of different factors, from individual factors to the type of work, to organizational and environmental factors. So what you will find is that you're often if somebody's suffering from fatigue may have a combination of elements from each of these boxes, if you like. So they may be a worker with a health condition, working in mentally demanding work, and working at night or doing shift work. So it'll often be a combination of these together that can be particularly impactful for fatigue. One thing to note as well, we're certainly learning more and more about workers with health conditions and some of the conditions that are of note here around sleep disorders. So the National Driver Licence Association, they have recently issued some guidance on sleep apnea, and one of the things they mention is that they estimate that about 100,000 people in Ireland may have sleep apnea. So a condition like that can really impact sleep quality. And then there are other things that arise too, such as in more recent years, many of us will be aware of long COVID. So the next slide I want to talk about is how we go about managing fatigue risk. So some of the things here that we can start to think about are, first of all, noticing, talking, acknowledging it. There's often little acknowledgement of this in the workplace. And making those informal conversations into a more formal acknowledgement in the form of a policy on fatigue. What do we know about good practice in design of working hours? This is something else that is really, really important to consider, and I'll cover on my next slide. Are there any awareness raising activities that we can do in the workplace around notifying or making people aware of the impacts of fatigue and on both health and safety? What can we do in terms of promoting any reporting around of fatigue and investigating it in terms of accident investigation? Are there other mitigation measures that we can put in place? And these could be quite individual or quite suited to one sector only, but there are other things around that you could do. So in some sectors, they look at napping or improving rest areas. Others look at just promotion of breaks. But what we're trying to do with this approach is really have some kind of multi-layered approach and proactive and reactive measures within that to try and stop all the weaknesses lining up to form a fatigue-related error. So yeah, it's just trying to tackle it from a number of different approaches. So I talk about good practice in design of working hours and shift work, and there's a lot on this in HSA's guidance for employers and employees, which I've linked to on the slide. You've got copies of all the slides, so you should be able to easily access links. I hope I've made those easily accessible on all the slides. But some of the things that this guidance talks about are the elements on the screen here. And these are basically the key factors that impact on the opportunity for good quality sleep. So this is where a lot of these factors can be derived from. So we do talk about start time, and obviously we know that depending on the operation and what is feasible, If you can avoid early starts, that is what the good practice would recommend, as in before 7 a.m. And the thinking there is to try and protect that window of circadian low, that 2 a.m. to 6 a.m., where we know people are more likely to be fatigued and there's a higher risk of error. Duration, the recommended approach is that it's a maximum of 12 hours on shift. And again, we know that error increases with increasing hours on shift. Rest periods, the good practice is to plan a minimum of 11 hours between shifts and 2 nighttime sleeps between shift changes. Breaks is around short breaks, 5 to 15 minutes every 1 to 2 hours, ideally away from your area of work if possible. And then other considerations are around the mental and physical workload and the number of successive night and day shifts. So those are some things that are good to take account of when you're looking at your design of working hours or your shift work pattern. But another thing that is a good thing to do as part of your risk assessment, as part of your control measures, is around awareness raising. And one of these could be you could do some awareness raising about the importance of sleep for health. And there, just put some resources on the slide here around things that you could use in this area. So Professor Matthew Walker, he's a neuroscientist, done some nice YouTube videos on how the importance of how sleep is important for health, and a couple of other ideas there for things that could be used in this area. I want to touch on now some of the things that other sectors and organizations, some of the approaches other sectors and organizations are using when they're trying to manage fatigue risk. And they talk about fatigue reduction and fatigue proofing. So fatigue reduction being, what can we do to try and prevent fatigue from turning up in the workplace in the first place? And then fatigue proofing is about, so when it does turn up, what can we do? And this particular table is being adapted from some guidance in the offshore sector. So one of the things I did want to point out from this is the organizational role and the individual role. So there are there's a shared responsibility here for the management of this, and we probably have needed to talk more about the organizational role, and not just focus on the individual. This is another method that has been used in some sectors and industry. So it's simply it's a sleepiness scale. I'm calling it a fatigue check-in tool, and this could be something to help workers articulate and rate themselves in relation to fatigue. So it's one way of trying to get a conversation around fatigue in the workplace. It can help raise awareness of who, say you do this at the start of shift, who might need support on shift and who can provide the support. So maybe someone who's a 4 can provide support to someone who's a 7, or and then it's an opportunity to maybe, okay, with that knowledge, what do we do differently on this shift? So yeah, it can be a useful thing to try and just get conversation going and acknowledge it in a more formal way. So just before I finish up, I just wanted to point some of the HSA resources and links that are out there. So there's a human factors section on the HSA websites with its own section on fatigue, but it also has other sections around reducing errors and non-compliances that are relevant to this. HSA has a online risk assessment tool, Be Smart, and fatigue is incorporated in that. So that's something that you could avail of. And then on the right, top right of the screen there, there's a human factors e-learning course. Introduction. So again, it's a free 20-minute course which will take you through a lot of the key principles and some of the key things I've talked about today. There's specific guidance on farm work, and then there's 2 pieces of guidance around night work and shift work. I said we're always keeping an eye on research in this area, so we are involved in research ongoing in the UK. It's known as the CatNaps research, looking at fatigue in the ambulance sector and how to design a fatigue risk management system for that sector. So just before I finish, some key messages I want to get across are that fatigue, it does have an impact on safety. It does increase the risk of accidents, injuries, and ill health. What I'd like to achieve from today is that we need to just talk about fatigue more and taking action on fatigue. Looking beyond the individual and recognizing there's an individual and an organizational role, and that leaders and managers can really play a role here in terms of supporting policy or any communication around this. They actively shape an organization and how work is undertaken, and it have a big influence on the culture in any organization. So we really need to make sure there's a managerial or leadership role in there to ensure that it does get talked about and some kind of action is taken in the area. And of course, the cornerstone of all the health and safety is around risk assessment. So on your risk assessment, I would suggest covering these 3 aspects in particular. So looking at the design of work hours, looking at what's possible in terms of education and communication on an ongoing basis too. So fatigue is one of those things I think that requires that constant flexible management. So keeping the conversation going and taking action in response to somebody reporting fatigue we need to do more than just have awareness. It is also taking action. And in that vein, I suppose I would encourage you, after listening to me, if you have listened for 20 minutes, to maybe consider, is there anything you can do as a result of listening today? It might just be having a toolbox talk on fatigue. It could be reviewing a risk assessment. It could be doing some promotion and awareness around importance of sleep for health. But I would encourage you to not only start talking about it, but seeing what action is possible to take. And I will stop. That's my last slide. I will stop sharing there. And I'm going to hand over to Matt.
Super. Thanks, Colleen. Thank you for that. Really interesting as ever. And as my presentation is just loading up, I'm an ergonomist, so a very different take, much more about the physical design of our work, but just with great gratitude. And it's lovely to see our colleagues Frank and Colleen and those of you in HSA. Really appreciate giving me a forum. So very good morning, everybody. I'm over in England and come from HSE, and like yourselves, we're very much focused on health at the moment in the UK, and so a little bit more on this, but designing for people who are doing the jobs that they'll be doing, in this case maybe more of a physical sense. And the graph on the right hand side, the big piece of pie, this is HSA data. It's a bit old now, 2019, so do forgive me, but the big piece of pie on that is manual handling related injuries. That's about 31% of injuries that you're seeing over in Ireland. Very, very similar here in England and across the UK. But with other parts of that pie as well, there'll be some of those, for example, 6% of those injuries about body movement, and that will be physical design of the workplace as well. Whereas on the left, it's just reminding me to say something really. When you do get injuries at work, there's always a desire to assess the task that people were doing just before the injury set in. And that's quite right. And that's exactly what we should do. But as Colleen's mentioned, this is a human issue, and humans have a home life and a work life and hopefully 24 hours every day and everything in between. And so when you are looking at people's, and we can only look at work, of course, the health, safety and welfare at work regulations is what we're under. So don't look too much about their home life activity, but if you do get people who do sustain an injury, that's about 80% of us, unfortunately, at some point in our lives. Try not to just look at the task the person was doing with the onset of pain, what caused this, what did you do? Try and look at their risk profile. The single biggest group of musculoskeletal problems are cumulative. Not such a bad thing has happened, but lots of moderately bad things may have happened. We never question them, so you do the same on a Monday, then a Tuesday and a Wednesday and so forth. And it's a greater proportion of injuries, you've seen that by, are cumulative in nature. So try to ask anybody, God forbid, who's injured, not what they were doing at the time of injury, but also what are your top 5 jobs that you do in a week, the top 5 heavy jobs. Try and assess all of those 5. And try and get a risk profile for that person's week. It'll give you a lot more information and a lot more opportunities to understand the risk exposure and hopefully reduce that risk exposure through good design. The process of this is captured in your regulations there. It's chapter 4 of the Safety, Health and Welfare at Work regs that captures this and tells you how to approach. And the first step is to identify all the manual handling tasks that need to be assessed as high-risk tasks. More on that in just a minute. Then develop a risk assessment schedule, and then the single biggest part of this is carry out your assessments. And there's a lot of guys that say, we'll stop and look at this in just a second. And finally, review the effectiveness of the control measures and your interventions. But let's just have a quick look at a couple of these, because I've got a few pointers and things that maybe you might find useful going through this process. And the first job is to identify the heavier, harder, more challenging tasks, maybe manual handling, maybe more postural related. And in your guidance, you've got some really good indicators there. Questions to ask about the tasks that people do. And the first question, are there heavy loads that people are lifting? There is also the risk filter, which you can compare the job against the risk filter and see where you exceed these. It's slightly different for male and female because we have different capabilities and different muscle masses, so heavier loads for men than women. The loads in these aren't absolute limits. You can lift more than these. It's just, and you can do so safely most of the time. It's just where you do lift more than these, all this is saying is then you should have a risk assessment in place and hopefully risk controls in place. But you may also use leading and lagging indicators, sickness absence records, or common tasks that you're seeing reported. By all means, absolutely still use those and keep an eye on those as you progress through this process. But very little be sitting down with a cup of tea or a coffee and a packet of biscuits and talking to your workforce. And I think to identify those high risk activities, cup of tea and engagement with the workforce is fundamentally important. As Colleen just mentioned earlier, same with the approach to fatigue. And to enable that and to hopefully support that, we've just in HSC published a new tool last year, actually, the body mapping tool, which is very free and easy to download. You can print it out and use it, but it has within it guidance on how to use it and tips and tricks and things that you want to think about if you're going to do this. But effectively, it's just this. It's a picture of a human body, and you sit down with the workers and ask them with a red pen or a green pen or something, put a dot on the parts of your body that you get regular pain in. The idea of that is that you'll see a collection of dots always in the same place, necessarily lower back perhaps, or one of the shoulders or an elbow. But then you can start looking at those commonalities and asking the same workforce, you've noticed there's quite a lot of dots in that left-hand shoulder, for example. What might they attribute tasks, to those kinds of aches, pains and discomforts. What is it that they think is causing these? It's a really good way of finding that commonality, where parts of the body are getting injured, and then starting to drill down into what tasks may be related to that. And it gives you a slightly more formal approach than a cup of tea. But it's something that we're using here over in the UK, and we'd commend to you. It's freely downloadable. In fact, if you've got a smartphone to hand, there's a QR code there in fact, grab your smartphones, because I'm going to present you with a few of these QR codes, intentionally messing up your internet search history. So if you wanted that one, please take a quick snap of it now. They'll come up again later, or of course you'll get the slides for some of these links. So once you've identified your high-risk tasks, those that are requiring maybe a bit of attention, you want to look more in a more focused fashion, and that will be a risk assessment process. It's really well laid out, and one of the important elements here is it also includes the HSE tools in this process, the MAC, the RAP and the ART tool, which I'll make a mention of. But it's really well laid out, and I'm not going to dwell too much on all of this. I'll stick to steps 3C and 3D in this version of it, which is the assessment, and then looking at results and resolving the issues with solutions. Under Schedule 3 of your regulations, there is a formal list of risk factors that you should consider. Now, look, I'm in envy of yours. Yours is better than ours. Over in the UK, ours is still from 1992 versions. Yours is a bit more pragmatic, I would suggest, and updated. But there is a formal list. I wanted to raise awareness of it to make sure you're not ignoring this, because I'm about to move on to the other version of this, or our version, which is openly used, and we'd really encourage you to use it in Ireland, which is the HSE tools. The RAP tool for pushing and pulling assessments, the MAC tool for lifting and carrying and team handling assessments, and then the ART tool, assessment of repetitive tasks. So those lower force, lower weight, but hand intensive operations like packaging and food and small parts manufacturing and things. And so, once again, please have at them a different QR code now, but these are all very much free to use at the point of source. You can download them, and that QR code will take you to online versions of these tools, which are just simplify the process. The idea is you use the app. It's kind of an app-based website, actually. Use that to fulfill your risk assessment and then email yourself the results. Nobody else will ever read your emails apart from yours. It's a miracle this morning that we've got teams working for the day. So please have at those at your leisure. And the idea is they highlight the key risk factors. A list of risk factors is embedded in each of those tools. And then I'm not going to patronise you, where you've got reds or purples for one of them, that's high or very high risk, amber's medium, green you can imagine. And when your risk outcomes happen, you also get a task score. So this version, we've got a score of 21. Those numbers are very useful for helping you prioritise where you start your risk controls. Higher numbers generally mean higher risk. But with these tools, this one's a manual handling, lifting assessment by the looks of things. And the top two risk factors, low rate frequency and hand distance and low brake. If ever you get reds in both of those, that's going to be a high risk task, no matter what the other scores are. They're the ones that you really want to be focusing on to look at the high risk tasks and resolve those first. And very commonly we get asked, well, when do you use the tools, the MAC, RAP and ART? There's some familiarity, but when do you actually go about using them? So look, it's Christmas coming up, and I don't know about you, but I'm doing nearly all of my shopping online. I'm not proud of that, but it's an inevitability. So I thought I'd just follow what happens with my shopping to try to demonstrate when you might want to use each of these tools. So before that parcel arrives on your front door, hopefully, you've got to put your orders in, and that'll go to a distribution warehouse where, if it's me, lots of last minute purchases, there'll be lots of small parts, small items being put into a bigger box. Now that sorting of small things into a bigger box, it may be a packaging task at the end of lines, maybe loading things up before at the start of a production line, for example. That's going to be relatively small items, so small weights, but a very hand-intensive operation. Lots of frequent repetitive movement in the hands. So we're not too worried about manual handling here. It's small weights, less than 8 kilograms, but it is hand intensive. It could create risk in the upper limbs, so you'd want to use the ART tool for that particular task, especially where the tasks are for more than an hour or two a day. That relatively low risk, but over long duration, could create injury worth looking at with the ART tool. But once all my wife's presents are in a box, hopefully somebody will maybe lift that box and carry it to the van for delivery. Well, that's a lift and a carry, potentially. So that's going to be a Mac tool to assess that lift and carry operation. Really very useful for bursts of activity and ideal for when lifting and carrying is done with roughly similar weights all day. If you've got huge variations in weights, have a look at the VMAC, the variable frequency Mac tool. Maybe though that box, if it's a good Christmas, that box is maybe too heavy to lift and to carry, so it might be put on a trolley, a dolly or a pallet truck or something. If that's the case, then the assessment will be with a wrap tool for pushing and pulling. All pushing and pulling, whether it's a wheeled item like a trolley, dolly, roll cage, you can assess that with a wrap tool, or if it's a non-wheeled item, churning barrels or rolling things, dragging things, you can also assess that with the wrap tool. Then our driver will start delivering it to hopefully one day my house. Even the driving task, there's a tool on there that you can start to assess called the BIRD tool, back injury risk for drivers. That's another tool that's on that QR code. It lets you assess the key risk factors for driving, including whole body vibration, posture, and a bit of manual handling. But it will suggest that you go off and use the Mac tool if you find manual handling risks. And then finally in this process, that final delivery to my front door, once again, a lift and a carry, that'll be assessed with the Mac tool. So there's a tool for most occasions. We're currently looking at the prospect of a lower limb tool, about 20% of injuries lower limbs, but give us a year or two before we're even close to doing that. We want to make the tools really easy for you to use, because where the rubber hits the road for you guys, where you become heroes and affect change, is in development of action plans and putting those actions into practice, mitigating and reducing risk exposure. And you guys in HSA have got really good, really quite up-to-date guidance on this. There's a guidebook for a lot of the busier sectors, the higher risk sectors. And so you can see amongst those maybe for transport and storage, for construction, for back injuries in the farm. But even if your sector's not represented there, look at those books anyway. If you're not necessarily working in the financial industry sector, you may be another officer as well. That bottom book there would be really relevant to you still. And once again, I think because of the efforts you've made in the last few years, I'm really quite envious of the guidance books that are provided on the HSA website. So I can independently, heartily recommend them to you. And amongst that guidance, hopefully with these links, you'll find specific case studies for manual handling or upper limb disorders, musculoskeletal disorders, risk reduction specific to certain sectors. And there's a really good selection of these, just to look at one of them, that construction one. What the case studies will do is present you with the problem, what is the issue going on there, present you with the approach to how they address the problem. In this case, it's a particular organisation that have addressed this, looking at the actual solution and how they've intervened to reduce manual or human exposure to the risk, in this case through mechanisation, and then what the return on investment and the other outcomes were for that particular issue. And so it walks you through a single case, but it shows you the process that people go to, hopefully to encourage you to try the same. And certainly on the return of investment, which is captured in these, at the moment, our most recent statistics came out a couple of weeks ago in the UK. We're finding that a significant injury, musculoskeletal disorders injury, leading to 7 days or more off work, is costing the employer predominantly around £10,000. It's almost exactly the same in euros at the moment, about €11,000 per significant over 7 day injury for musculoskeletal disorders, and indeed any health issue. So on the return on investment, argument. It's certainly one that opens doors. It's one that we'll have you explore. That's not your job. Please don't spend all your time on an Excel spreadsheet looking at that. Back of an envelope kind of calculation to work out how many injuries might we be able to reduce here, and gives you some idea of how much investment's really worth making, and hopefully it'll make that investment in solutions easier to justify and take it from an overhead into an investment. And last QR code for you, but while you're looking at potential solutions, this isn't from the UK, this is from Washington State actually, but we found this a few years ago and we're big fans of it. It's an ergonomic ideas data bank, a huge selection of potential solutions for ergonomics, and you can search by industry, search by a particular topic. So if you're in the construction sector and the job you're looking at is about lifting overhead, we can search for those and look for an array of solutions on this data bank. It's a little bit commercial. It might want to take you to a website to have a look at, you know, someone's brochure. That's fine. The idea is you don't buy it, you just look for inspiration, look for ideas from this, which is a rather nice way of doing things quite quickly. And then finally, I suppose on the action plans, we often will turn to training. Training, especially manual handling training, it is important. There's not a lot of evidence about how effective training actually is in the science fraternity. The academics don't collect lots of evidence, but anecdotally, we believe it's actually really important, can be very effective. And don't forget, it's one of the things that you can give people at work, which will actually be transferable to home. People can take that good knowledge you get from training and start behaving in ways at home when they're doing their moving house, gardening or whatever. They can behave in those ways to hopefully protect themselves from injury that are home-based as well. Training can't overcome rubbish jobs, and it should always aim at changing people's behaviours. And training, over in the UK, we're looking now at really getting rid of all the off-the-shelf, just generic training. E-learning is a great start. You can get concepts across with videos and things, but it should never be the end of training. We should have, the training should include actual systems of work that are used in the workplace, using the work tools on the work site. You can't do all of that if you've got a heavy manufacturing plant. If you're a noisy manufacturing plant, you can't do training against the lines at all. You have to start in the classroom. That's where e-learning might be useful on videos. But you want to take that training into application in the actual work site. So that practical work is really, really important. So people get to practice what they're learning in the classroom. And the last thing I wanted to mention was just this piece of work about action planning. What's the actions to take after, God forbid, but someone's been injured? About 80% of us will get injured, and about 80% of those injuries will recover on their own. The vast majority of back pain will get better within a couple of weeks on its own if someone gets good advice. And so there's lots of mechanisms to get that advice to our workers, to our colleagues. We've all looked at this and looked at return on investment for these, but this particular report from Public Health England, whose name's changed post-COVID now, but they did a piece of work looking at different interventions ad hoc after someone's been injured. And the long story short, and a really good report short, what they found was that there was a particular intervention that for every £1 people invested in that, they got a return on investment of about £98 back, which is a magical investment. They did it. It was a really good research. Took more data than any of us ever managed before, and to get that £98 return on your £1 back, or translation to euros, I'm sure it's the same. The intervention that was really, really effective was quick exposure to a physiotherapist. Get people into a physio for quick diagnosis, early treatment, and quick affirmative advice for managing their health. And it really reduces the losses of people going off work for sickness absence and so on and so forth. So I'd commend that to you. I'll put a link to that report in the chat once I finish speaking, about 3 minutes time, or about 1 minute time, sorry. But I would commend having a look at that if you're looking at ways of managing people who do get injured in the most effective manner. So that's all I wanted to say, really, other than thank you very much for having me. And they are the links I've used throughout. So if you're quickly scratching for a phone, get those QR codes now.
So thank you very much for joining us, everybody, and we wish you all the best, and we'll probably see you again in the new year. Thanks, Matt. Thanks, Colleen. Thanks, everyone. Take care.
Thank you.